Schizophrenia is probably one of the most ill-treated, stigmatized, and misunderstood psychological disorders that exist. Although schizophrenia is a widespread psychological syndrome, there are misconceptions where people would assume that schizophrenia is this one disease that causes all these extreme behaviors. Kind of. Actually, there are many different types of schizophrenia, all different in the behavioral symptoms and distinct characteristics. First, the most commonly occurring type of schizophrenia is paranoid schizophrenia. Patients of this subtype do not display major symptoms until at an older age, which makes it difficult for others to spot abnormality in the way they act. This subtype often triggers its patients to have delusional thoughts and images, especially about persecution and suspicion and others plotting against them, which may provoke forms of paranoia in the patients, such as hearing voices. The second subtype is disorganized schizophrenia, which largely affects the patient's thought process. This causes them to speak in a disorderly manner, using unsuited vocabulary and disarranging the words in a sentence, which makes their speech often difficult to understand. Also, when answering a question, their answer may be completely irrelevant or off topic to the question asked. In some cases, patients with disorganized schizophrenia are unable to complete everyday tasks such as making a meal or getting dressed. The third subtype is catatonic schizophrenia. It often affects its patients to exhibit extreme measures of movement impairment. There are three major characteristics: catatonic excitement, catatonic stupor, and stereotypic movement. Catatonic excitement is when a patient undergoes sudden hyperactivity that causes them to imitate sounds or motions that they capture in the environment. These two are also known as echolalia and echopraxia. On the other hand, the patient may show a sudden decrease in movement to a point where they seem frozen in place. This is called catatonic stupor. Lastly, stereotypic movement is visualized when the patient would continuously repeat assumingly purposeless actions without realizing it. Finally, residual schizophrenia is when a formal patient is no longer exhibiting extreme conditions. Usually, patients are able to return as a capable individual to society and in their daily lives. Schizophrenia is a genetically transmitted disease, usually caused by certain types of genes or genetic mutations that affect brain development. However, it is still a partial mystery to how they are caused. Schizophrenia can be treated in different ways, and the first way is to use antipsychotic medications. These medications focus on eradicating the symptoms such as hallucinations and distorted hearing, but are not effective in completely removing the disease. Another method are psychosocial treatments. This method helps the patients to repossess social stability with the guidance of a counselor or a therapist. Nowadays, there are many other ways of treating schizophrenia in the modern society, and there's help all around you whenever you need it. Remember, mental health is as important as physical health.